Hi everyone, welcome to the lectures of Swasthavritta. Today we are learning about vitamins. First point is derivation of vitamins. Vitamin is derived from vital, which is important, and amines, which denotes amino acid group. It is organic compounds required to the body in small amount, so categorized under the micronutrients. It means vitamins are categorized under the micronutrients. Also certified under protective and regulatory food. Function of vitamin are growth, metabolism, immunity, tissue repair. They are the part of balanced diet. Classification of vitamins. Vitamins classified into two types, fat soluble and water soluble. Fat soluble vitamins dissolve in fat. They are stored in the body tissue and their examples are vitamin A, vitamin D, vitamin E, vitamin K. Water soluble vitamins are not stored. Its example is vitamin B complex and vitamin C. Vitamin A, it covers vitamins and provitamins, also known as retinol, from gained or resource is from animal source. So the provitamin that is beta carotene in the presence of intestinal mucosa convert into retinol. Then what are the functions of vitamin A? The functions are vision. First one is vision. In that, normal vision. As also the synthesis of retinol pigment, which is helpful in the vision. Next function is normal functioning of glandular epithelial tissue, which lies in the intestinal, respiratory, urinary tract, and skin mucosa. It depends on the vitamin A. इसका मतलब क्या है? ग्लैंडुलर एपिथेलियल टिश्यू का जो नॉर्मल फंक्शनिंग है वो करने में विटामिन ए हेल्प करेगा, ठीक है. तो वो नॉर्मल फंक्शनिंग क्या है? तो इंटेस्टाइनल, रेस्पिरेटरी, यूरिनरी ट्रैक्ट और स्किन का जो लेयरिंग है, अंदर का जो म्यूकोजा है उसको लाइन करने का काम ये विटामिन ए की वजह से ग्लैंडुलर एपिथेलियल टिश्यू करेगा. वो करने के लिए उस टिश्यू को विटामिन ए की ज़रूरत है. सो द नेक्स्ट वन हेल्प्स इन द ग्रोथ, स्पेशली द स्केलेटल ग्रोथ. Immunity, low immunity found in vitamin A deficiency. Protective against some epithelial carcinoma. Sources, animal sources and plant sources. There are two types of sources. Animal sources are liver, eggs, butter, cheese, whole milk, fish, meat. Plant sources are green leafy vegetables, yellow fruits like papaya, mango, then pumpkin and roots like carrot. Storage, it is stored in the liver, and in liver the secretion of retinol pigment is done. The amount of pigment is like sufficient up to 6 to 9 months easily. So what happens if a vitamin A deficiency occurs in our body? Then there are two types in the deficiency. First one is predominantly what happens, and less commonly what happens. So vitamin A deficiency commonly what happens, that is predominantly what happens ocular. In that two types, xerophthalmia and extraocular. In less commonly diseases, they are xerophthalmia, all ocular manifestations, night blindness, conjunctival cirrhosis, bitter spots, corneal cirrhosis, keratomalacia. These are the diseases. Then measure for prevention, important improvement of diet, Intake of vitamin A rich food regularly in sufficient quantity by preventing other causative factors like respiratory infection and diarrhea. Then, what are the toxic effects? Toxic effects include excess consumption of retinol includes nausea, vomiting, anemia, sleep disorder, skin disorder. Next vitamin is vitamin D. We also call that vitamin as kidney hormone. Nutritionally important forms of vitamin D are vitamin D2 and vitamin D3. Now this vitamin D2 is it causes the irradiation of platesterol and ergosterol into the calciferol, and vitamin D3 causes the animal fat and fish liver oil convert into calciferol. Vitamin D is dehydrocholesterol. It is stored in fat and or depots. It also known as sunshine vitamin and kidney hormone. It is metabolically inactive vitamin. Vitamin D undergo transformation in liver and kidney. It does not fit into classical definition of vitamin. The important functions. What are the important functions of vitamin D? In the intestine, vitamin D enhances the absorption of calcium and phosphorus. It stimulates the mineralization of bone. In the kidney, it enhances the tubular reabsorption of phosphate. It is helpful for the normal growth. What are the sources of vitamin D? Occurrence is animal food only. So, vitamin D can be obtained from liver, egg, butter, cheese, fish, and liver oil. For fortified food like milk, vanaspati, and refined oil, when skin get exposed with sunlight, the 7-dehydrocholesterol present in the skin convert into vitamin D. Deficiency. What are the diseases that cause because of the deficiency of vitamin D? First one is rickets in children, and second one is osteomalacia in adults. Measures and preventions. First is health education. Second, prophylactic doses of vitamin D in children. Third, fortification of milk, vanaspati, and refined oil. Vitamin B complex. Each vitamin B has specific functions, mostly related to energy, metabolism, nerve function. Vitamin list is B1 thiamine, B2 riboflavin, B3 niacin, B5 pantothenic acid, B6 pyridoxine, B7 biotin, B9 folate, B12 cobalamin. So vitamin B complex is the most important vitamin. You can get ASQ or ELQ over this vitamin B complex only. So listen carefully. In that first one is vitamin B1 thiamine. It is water soluble, required for utilization of carbohydrates. Source is plant source and animal source. In plant source, we can obtain vitamin B1 from whole grain cereals, wheat, gram, pulses, oilseeds, nuts, groundnuts, etc. And from the animal source like meat, fish, eggs, etc. Deficiency of vitamin B1 causes beriberi. In that two types, dry beriberi and wet beriberi. Dry beriberi is neurological and wet beriberi is cardiac. Prevention health by health education and improvement of diet. Vitamin B2 riboflavin, water-soluble vitamin responsible for cellular oxidation, cofactor in number and enzymes. Source is milk, eggs, liver, kidney, green leafy vegetables. Deficiency of vitamin B2 causes angular stomatitis, chillosis, mainly affect the tongue and lips, also known as aceboflavinosis, hyporiboflavinosis. Next is vitamin B3, also known as niacin. It is water soluble, required for metabolism of carbohydrate, fat, and proteins, required for normal working of skin and nervous system. Sources are animal source and plant source. In animal source, it is occurred or received or get from liver, kidney, meat, poultry, fish, and from plant, legumes, and groundnut. Deficiency of vitamin B3 causes pellagra, dermatitis, diarrhea, dementia. Vitamin B6, pyridoxine, water-soluble vitamin, prime role in metabolism of amino acid, fat, and carbs. Sources: animal source and plant source. Animal sources are milk, liver, meat, yolk, and fish. Plant sources are whole grains, legumes, vegetables. Pyridoxine, vitamin B6 forms pyridoxine, pyridoxal, pyridoxamine. Deficiency of vitamin B6 causes peripheral neuropathy. Vitamin B5, pantothenic acid, water soluble, important role in synthesis of corticosteroids. Deficiency is rare. Vitamin B9 is folate in the food, folic acid from the food, folic acid. It has two types, free folates and bound folates. Free folates rapidly absorbed from intestine and bound folates absorption amount is uncertain. Helps in synthesis of nucleic acids essential for normal development of blood cells. Sources are animal source and plant source. Animal sources are liver, meat, dairy products, egg, milk. Plant sources are fruits, cereals, green leafy vegetables. Deficiency megaloblastic anemia. Next is vitamin B7 biotin. Coenzyme it works as coenzyme in metabolism of carbs, fatty acids and amino acids. Deficiency of vitamin B7 causes deficiency is rare, but if causes it causes scaly dermatitis. Then vitamin B12 cobalamin complex compound with cobalt atom used as cyanocobalamin in therapy. It helps in synthesis of DNA, fatty acid, myelin. Sources only from animal source. Examples are in liver, kidney, meat, fish, egg, and milk. Deficiency causes megaloblastic anemia. Next vitamin is vitamin C, which is water-soluble vitamin, most sensitive for heat. Sources are fresh fruits, leafy vegetables, gooseberries. Function of vitamin C are collagen synthesis, antioxidant activity, improves iron absorption, prevent common cold and infection. Deficiency of vitamin C causes scurvy, bleeding gums, poor wound healing, and fatigue. Next vitamin is vitamin E, tocopherol, also known as anti-sterility vitamin, fat-soluble vitamin. Sources are excessively distributed in foods like vegetable oil, cottonseed oil, soybean oil, sunflower oil, almonds,
groundnuts, egg yolk, butter. Functions are powerful antioxidant, help in maintaining integrity of cell, especially RBCs and muscles. Deficiency is rare, may used in hemolytic anemia and neuromuscular problems. Last vitamin is vitamin K, occurs in two important forms, vitamin K1 and vitamin K2. Fresh green vegetables, vitamin K1 we can get from fresh green vegetables, fruits, milk. Vitamin K2 synthesized by bacteria in intestine. Storage, liver, function essential for blood clotting, plays role in bone metabolism. Deficiency is bleeding disorder. Thank you so much for watching till the end. Now, some points I have to tell you that these are the notes which I have made before my exam. Tomorrow is my exam. So these are the notes which are beneficial for a 10 mark question and 5 mark question. This is all the information you needed for the topic vitamins. This PDF you will get the link, or you can just DM on my Insta page. Thank you so much.